the most important newspaper here, look at me, I was 32 years old only.
How did you figure this out?
Huh? Look here.
Do you see his picture?
Sí.
¿Cómo descubrí tratamiento? How did you discover it?
¿Cómo descubrí? Bueno, did you see the video?
You saw.
I saw most of it. I don't think we saw all of it.
He did. But you didn't say much about why.
Well,
How.
I can make a how to say, summary.
Okay.
Well, I began studying all the methods for early diagnosis of cervical cancer.
Oh.
So I after doing my 3 years residency in OBGYN, and then I went to province to work for 3 years, and then came back to Santiago. And I worked at the military hospital.
Oh.
So I funded the laboratory of Papa Nicolau smear. So I have to work with a microscope. So that's the reason I take some sample from the cervix and look here. And with the colposcopy, I can see how is the uterus in a special view, increased view.
Yeah.
And the uterus, when you say uterus, you're talking about this part of the uterus?
Yes, but it's not so important what commands the situation are the symptoms.
Yeah.
If you have symptoms, you are sure that you have inflammation that you can see, or maybe you cannot see because it's inside you.
But how far do you see? Just up to here?
No, it's not necessary to see, because when I touch the uterus, it hurts.
Yeah, that was
Oh, you
for
mean
me.
the bimanual exam?
Yes, but when you touch the cervix,
Oh, the
Yeah.
cervix.
she said on here, this part of the cervix,
The os.
well, hurts her.
So after treatment doesn't hurt when you touch.
No.
Oh, wow.
Absolutely.
It hurt a lot. Yeah.
Just
Yeah,
to touch the
yeah.
os.
He touched it and it was like, ow.
Yeah.
Yeah.
So that's the reason, because again, gynecologists usually they do not do a good exam
Yeah.
of the uterus.
See.
They think that with the ultrasound, it's enough. And the ultrasound for this kind of pathology is absolutely not useful.
Well, the routine exam, no colposcopy either.
Oh yes, colposcopy, some doctors, and they are only looking for when the pap smear is positive to see where is located
Oh.
the cancer of the precancer.
Okay.
So they are all taking care only on cancer and the inflammation. They say that it is not important at all. With one of the biggest mistakes that gynecology historically has committed.
Yeah.
What do you say about that?
I agree.
And they don't want to accept that because they will feel ridiculous in front of all the world.
Yeah.
And what's been done for so long.
Yes.
Yeah.
What do you think about that?
Frustrating.
Lucy, will you introduce yourself for this video?
Oh,
Please.
Hi, I'm Lucy Judson. I'm a PA and a good friend of Kaila's. And I'm down here for 2 weeks while living with Kaila while she goes through these 2 weeks of treatments anyway.
PA in family practice,
PA and family
Boulder,
practice.
Colorado.
Boulder, Colorado, yes.
Thank you.
And in Colorado, what is the percentage of women that they suffer from severe PMS, do you think?
Al menos 25%. Al menos.
25.
Al menos.
So 1/4 of women, they suffer from severe PMS?
Severe, maybe not.
Maybe not severe.
2 to 8.
But I don't know what the definition of severe.
Yeah.
So the definition, at least 25% suffer,
So, yeah.
but not of severe.
But severe, what percentage you think? 10%?
8 to 10?
Yeah. And Kaila was
One of them.
One of them, huh?
Yes.
So when did you realize that Kaila was suffering from PMDD?
Oh.
How many years ago?
I told her 4 years ago
4
Yeah.
years ago.
when I moved there, but she's not my doctor, just
Yeah.
friend. Yeah.
Right.
Dr. Lolas, will you explain the blood sugar thing?
Oh, the problem is that the uterine cervix usually function with prostaglandins,
Mm-hmm.
and prostaglandins are inflammatory mediators.
Which is why people take Advil all the time for cramps.
Yeah, and the prostaglandin and other inflammatory mediators are in the function of the uterine cervix. In its dilatation, you say?
Mhm.
How do you say in English?
Dilatation?
Dilation.
Huh?
Dilation.
Dilation,
Mhm.
yeah?
Yeah.
And it commands the menstruation. This knowledge is unknown by medicine.
Unknown.
They do not
Oh,
know
wow.
that the cervix is the computer of the uterus.
The computer of the prostaglandins.
Yes. So that's the reason they don't understand that the uterine cervix is so important.
Yeah.
And sometimes, like Kaila, you are not seeing very important inflammation when you look at the cervix.
Yeah.
Right.
But when I touch the cervix,
Mhm.
she accused the pain.
So the problem is you want some prostaglandins, but you don't want too many.
Yes, the problem is that the prostaglandin E is one of the mediators that are involved in PMS.
The mediators, yeah.
Uh-huh.
But you can't get rid of all of them. You can't get rid
You
of
need some for menstruation.
Yes,
Yes.
yes. And usually, when a woman has severe symptoms, the level of prostaglandins
Oh, it's high.
are very much higher than women without PMS.
Was that one of the lab works that
Yeah,
you
I
had
don't.
done?
Did we check my?
Prostaglandin?
No.
Oh, we didn't check.
No.
You can't check it in the
No,
blood.
because they are very specialized laboratories that do it,
Mm.
because it's very, very expensive,
Mhm.
this exam.
Uh-huh.
I tried 25 years ago that here some laboratory would do this exam. No, nobody,
Wow.
because they say that it's not commercial.
Oh, it's not.
The reactive they use are very $1,000 an exam.
Yeah.
Wow.
Yeah. So when women go to the laboratory, most of the exams are normal.
Right.
Huh? So they have no laboratory parameters to measure the problem.
So the blood sugar thing, though, I still don't understand.
Well, I am going to finish the idea.
Okay, sorry.
The prostaglandins, they act on the pancreas.
Oh.
And I have an endocrine book
Mhm.
from 40 years ago, and they say the prostaglandin will produce excess of insulin.
Oh.
Wow.
So then your blood sugar drops.
Yes, so the sugar goes down, and women feel bad, like fainting.
Yeah.
And they have urgency to eat
sugar.
carbohydrates.
Wow.
And most of women are.
Fat.
Did you notice the only thin person at the whole Congress was Kaila?
Not
But
the
all-
only one.
But all the others were.
And so and literally I feel lightheaded sometimes before I have my period.
Mm-hmm.
So now, did you understand why they have hypoglycemia?
See.
Right.
And I have that. Yeah.
Yes, but I know.
Oh, yeah.
And the other thing that they usually find in women with PMS polycystic ovaries.
But you don't.
I don't have that.
Yeah.
No, it's not usual, but very frequent.
Yes.
And they think that the polycystic ovary is another entity. And I think it's a consequence of the inflammation of the uterus.
Long term. Wow.
What do you think about, depression separate from this? Let's say it's real depression, you don't have any PMDD. That people with depression will tend to eat a lot of carbs to increase the serotonin.
The problem is everybody is blaming the serotonin.
No, I'm only talking if somebody has depression, but if we say we have somebody that just has depression and no problem with
But
the
even
symptoms.
that is there's
But
now
now
evidence of
they
inflammation.
are
What about a guy?
discovering,
Yeah,
What about a
inflammation.
now they are discovering that every time a person suffers from depression, it's related with inflammation.
Yeah,
Oh, for men too.
Yes, for men
everybody.
too.
Yeah.
And I have seen some husbands that had chronic prostatitis
Wow.
and they develop depression also.
Wow.
It's interesting, I have a twin sister and we both suffered from depression.
Twin?
Identical twin. I am.
You have it's like you, the same?
Exactly. Almost.
You know her, huh?
Yeah.
But she is not doctor,
No, professor.
huh?
She lives in Vermont. I live in Colorado.
Vermont is northern than Colorado?
Northeast, no, like near Massachusetts.
Oh, there.
Boston, yeah. But she and I went through severe depression during menopause. She was in Costa Rica for the year studying, and I was in Colorado. And our older sister, nothing. But she and I, just interesting.
What happened?
With menopause,
Yeah,
right?
with menopause.
Yeah.
I mean, we were both going through menopause.
How old are you?
And now, 65.
Yeah, and at what age did you get your last menstruation?
42?
42. And tell me, did you suffer from depression after that? Did you suffer from depression on the menopause or not depression?
No, depression.
You
Yes,
and your sister also.
yes.
And did you feel abdominal bloating also?
No.
No. And what other symptoms besides depression did you feel?
Headache right here.
Headache. Yeah.
Like a skull cap.
Yeah.
Skull cap headache.
And what other symptom?
Well, fatigue.
Mm-hmm.
Fatigue, anxiety. That's it.
Yeah?
Yeah.
And now, how do you feel? You have depression,
No, but I take Prozac.
so you have to take a symptomatic treatment.
And
Let me see your tongue.
Dry now.
Yeah. And tell me, you have dry here, your legs?
Not terribly for
Yeah.
65.
Do you feel pain in the lower part of the abdomen?
No.
No pain at all?
Mm-mm.
You see, I have a certain experience with postmenopausal women
Oh.
mm-hmm.
that have come for symptoms similar to PMS.
Mm.
And I looked under colposcopy, they have inflammation.
Uh-huh.
So I proposed them that under my theory, if I cure the inflammation, maybe the depression can disappear.
Mm.
And I made the treatment and disappeared.
Wow.
So it is another point
Another
of
aspect.
view of the depression that is perimenopausal or postmenopausal.
See.
Mhm.
What do you think about that?
I don't know what I think.
Huh?
I don't know what I think.
¿Que no sabes lo que
No
pensar?
sabes lo que quiero, lo que creo. Okay.
Yeah, I have another experience. I have women that I have treated them 43 years ago. And yesterday, not on Monday, she came. She is 84 years old.
Wow.
Wow.
And I have treated her when she was 41. Was the first patient I had with this problem.
Menopausal.
No. She came suffering for all the symptoms of PMS. And
At
I-
81?
No,
No,
she
at
came
Oh,
40
wow,
years ago.
okay.
40 years old.
Disculpe.
And she has never suffered since then any problem, and she doesn't need to take any antidepressant drugs. So this is also a revolutionary point of view of the problems the women perimenopausal
Sí.
and postmenopausal have. And the doctors think that is of lack of estrogens.
Right.
Dr. Lolas Talhami, do I have permission to put this video on the internet?
Where? In the Facebook?
See,
And how do you find it?
I will tell you. I don't know yet. I'm gonna ask NAPMDD, Amanda, but also just my personal.
Yeah.
Is that okay?
And you think that I communicate well in English?
Yes.
Yes, very well.
Yes? Okay.
Yeah, good video.
Yeah.
Okay?
Yes.
Okay. Gracias.